Good morning, friends. Myself, Dr. Manish Agarwal, diabetologist and metabolic physician. And my area of interest is diabetes, hypertension, cholesterol, ISD, dyslipidemia. I am running of the 90 bed of the hospital named of the Medellin Hospital at a prime location of the satellite Ahmedabad. Just I am going to talk all the non-communicable diseases are lifestyle modification disease. What all? Lifestyle, they need diet, exercise, yoga, meditations, walking, this particular. And the month of the June, dated of 21st June and Saturday, we are going to celebrate the International Yoga Day as the Prime Minister respected of the Narendra Modi sir of his vision of we are going to celebrate at Medellin Hospital. So what is yoga? So if you are living the heart disease and diabetes, I am talking with the heart disease, I know it can something feel overwhelming, but today I want to share something of the simple, natural and incredible powerful yoga. Yoga is just about the flexibility. It is not a movement, it is just medicines. It's about finding the balance from the within. Certain pose can be regulate your blood sugar, lower stress. 2/3 of the diabetic patients, they are having some of the stress or anxiety, but some of the yoga can be reduce the anxiety and the stress. Gently strengthen your heart. In this video, I will walk you through the benefit of some asana. And some certified yoga expert of the Mrs. Shweta Varpe and her colleagues, Mrs. Suchita, will show you how to do the safety and correctly. Just get the start, get the one step close to the healthier and calm of your. Just I am going to sort of the few yoga discussing the talent what of doctor. Need the pose of simple, it is a very powerful yoga. First step to strong the heart. Your heart become in diabetes. We are seeing of the heart is become weaker and weaker. Such type of the yoga we can control your diabetes, and where heart is become more stronger and healthier life. It is just like mountain pose. Is going to go to the better heart health and your sugar is well controlled. India is a capital of the diabetes, and particularly we are in the 140 millions are diabetic. Unfortunately, is a more than 140 millions are pre-diabetic but some of the yoga meditations will be of the control of your diabetic part and pre-diabetic. This yoga, it aligns your body and open your lungs and boosting the oxygen. We have seen in 2019 to 2020 where 21 is a COVID area, there is a lack of the oxygen. But this yoga was very perfectly to the lungs improvement and lung circulations and blood flow is going to increase your lungs. This the doesn't help your use the body insulin more effective. It's a big win of the diabetic care because of the most of the diabetic patients, they are having the insulin deficiency and insulin resistance, but such type of the mountain position is going to the more insulin sensitizer. Or apart from, with every deep breath, we are taking a deep breath, it calms your mind, reduce the stress, and stress is a silent killer of the heart attack. Even the Indians, we are seeing of the every Indians, most of they are suffering from some of the stress of this one. So this is very fantastic yoga, and I am a take home message of this yoga is a very helpful. Not only your heart is stronger, as well your diabetes are going to control of that. Next, we are going to the Vakrasana. Let's begin the Vakrasana. Vakrasana is a half of the spiral twist. It is a gentle sit twisted.
Vakrasana. Keep your both hands forward, parallel to the ground. Touch your both the thumbs.
Turn your right side very gently, slowly, gently. Focus on your gaze on your right hand, touching your left hand to the shoulder. It is gentle vakra, twisting to the lower back. Inhale very gently come in the center. Again, both the hands parallel to each other, both the thumb touching each other.
And I am tell all my viewer, before going to any yoga, any type of the yoga, Vakrasana, NLD, Sirsasana, you should consult your doctors. I am seeing of the most of the patients, they are doing of the half spinal twist and they are in the cervical spondylitis. Suppose they are doing the Sirsasana of this particular diabetic patient, they are having the retinopathy and retinal detachment are more common of the Sirsasana doing the. So before going to any yoga, you should consult with your clinician. So Vakrasana is a half spinal twist. It is a gentle seat twist. It works deep, especially manage a diabetic heart condition. And this posture, you stimulate your beta cells of pancreas by the increase in blood supply. Or whenever the blood supply is going to increase your beta cell, insulin are going to surge from the beta cells. Or Vakrasana also is lower the blood pressures and improve the circulation, and it is going to ultimately who are going to victim? Heart is going to victim. But this Vakrasana is a healthier for the heart. Just as important, it calms the nerve system also, because already I have discussed of the stress and anxiety is a key trigger of this particular always stress or anxiety. All the diabetic, 2/3 of the diabetic patient, 2/3 of the non-communicable disease, they are having some of the form of the anxiety stress. Once anxiety is stress, some of the stress hormones are going to increase and spikes of the sugar and blood pressure of this particular. Now I am going to the third position, tree positions. Doctor looking for the balance, body and heart of the Vakrasana is a tree position.
Let's start with Vrikshasana. Right leg, inhalation, keep on the groin of left leg. Now both the hands sidewards, inhalation. Join your both the hands, go behind your ears, focus on one point, turn your palms, exhale. Very gently come down. Very gently.
It is more than just standing tall. It is a very of the heart friendly powerhouse. और हार्ट के अंदर मसल्स होती है, उसको माइटोकॉन्ड्रिया को स्टिमुलेट करती है. It enhances the circulations, delivering the oxygen and nutrient where your body needs them. And tree position calm the nervous system. So almost all the yoga position is a reduce the stress and anxiety. It is a major risk of your heart disease, extended leg and core. And what I am telling this particular, his leg is calf muscle is just like your peripheral heart. Once we are going to contraction of the calf muscle, endorphin and some of the hormones, happy hormones are getting released of the core, improve the balance, stability and supporting the healthier heart. Roots yourself, breathe deeply, let the Vakrasana help your heart and become more stronger and stronger. Now again I am going to fifth of this particular the Shivadasana. We have the Shivadasana is a ground pose, blend strength, stillness. It is excellent for the blood sugar control as well as for your healthy heart. This pose can improve the insulin sensitivity. I am talking with the type 2 diabetes is a insulin resistance, and this asana is going to the insulin, most of the insulin sensitizer, making your body better at use of glucose efficiency. Practice regularly. This position may help the stable your blood sugar, reduce the risk of the spike and postprandial, because Indian is a typical more carb lover and postprandial blood sugar is a big issue in our country. It also gently strengthens the body, improve the blood circulation, most important for the keeping the heart or the heart healthy. Just like more yoga positions of this lot of the yoga position of the Shivardhan help to calm your nervous system. So almost all the yoga position, they are going to help your the stress, anxiety, your anger, or ultimately who are going to victim cardiovascular risk factor, your heart, blood pressure, your diabetic. So my take-home message is yoga is a very fantastic. All the non-communicable disease, just like diabetes, hypertension, heart disease, all this particular, all are lifestyle discipline. Once you are yoga, already I have discussed, yoga is not a movement. Yoga is just like behavior as a medicine. What about that? I am telling all my patients of this building is having the 4 pillar. One pillar is diet, one pillar is exercise, one pillar is medicine, and one pillar is yoga. So this building stand the 4 pillar of the. So yoga is a benefited your blood sugar, blood pressure. Ultimately, who are going to victim? Well, suppose we are not going to control your diabetes, your blood pressure. Ultimately, who are going to our heart is going to victim of the heart become more weaker and weaker. Once we are going to yoga, meditations, of the walking, and your diabetes is getting control, blood pressure is getting control, stress and anxiety are getting, anger are getting control, or ultimately become hard to make. Heart is become more stronger and strong. I would like invite all my friends who are Facebook connected. This particular, I am going to invite very big yoga on the 21st Saturday, 7 to 8 a.m. with our vision of the respected Prime Minister of the Narendra Modi sir. We are keeping of the yoga of the various garden surrounded the Medaling Hospital. We are keeping at Medaling Hospital terrace, all the Amul Garden, Anand Nagar, all this particular. But we are going to connect it the almost 5,000s of the yoga of the who are patient, who are diabetic, pre-diabetic, or what about the. Thank you. Jai Hind, Vande Mataram.